we've looked at this issue in Lagos and generally across the sub-region. Of course, there are multiple reasons how a virus will interact with an ethnicity of people. So there might be environmental factors, there might be genetic factors, and then there will obviously be a demographics. So when you look at the way the virus has ravaged most of the Northern Hemisphere, something stands out, and that's the age and the underlying metabolic syndrome. So as the key outstanding risk factors. So the sub-region has what we call a pyramidal demographic profile. So the base of the pyramid is full of young people, and as you go up the pyramid, you get fewer and fewer numbers in that escalating age group. Whereas Europe and America have something like a inverse pyramid. It's not exactly inverse, but it's kind of bulging at the top and tapering towards the younger age group. So where fertility rates are very low in Europe, for example, you have a bigger age group of over the 50s. So for us, I think one of our key saving grace is this pyramidal age demographic profile. You know, with the bulk of people in Lagos, there's a youth bulge, and for some reason, just looking at the profile in Lagos, it fits. Young people have a very age group, have a moderate to severe disease profile. And then if there are underlying conditions, particularly the metabolic syndrome profile of diabetes, hypertension, and obesity, then it goes for that particular group of people. So looking at what's happened in the Northern Hemisphere, looking at what's happening with us, I think we're very, very lucky. What we need to do is to really ramp up the ability of Lagosians or Nigerians or wherever to respond almost immediately with a research medical countermeasure strategy. And that involves being able to develop an innovation pipeline. So an innovation pipeline means that you take your research strategy from beginning to end in your environment. You don't have to get to a certain point and ship out the samples and the data to China or to America for them to complete the research cycle. We need to be able to complete our research, our innovation, our research, and develop the innovation pipeline on ground, which means you need a certain amount of human resources in health, expertise, and equipment, and understanding. And for you to have that, your government just needs to understand that they must invest a lot more in R&D around the medical sciences and the medical fraternity.
What policy changes do you think government should apply, you know, in this situation, also to have to show support also to the population that would maybe potentially have more access to healthcare, you know, to insurance coverage and so on and so forth. What do you think?
Okay, so you know, I think you know, Africa shouldn't really follow the copycat trend that's going on around the world. You know, how do we respond to COVID? How do we test X numbers of people? How do we do this? How do we do that? You know, COVID, to me, COVID is just a symptom of a deeper problem. You know, we need to understand what is behind COVID. Why, and for us in Africa, we are seeing wave after wave after wave of what we call emerging infectious diseases. So these are the zoonotic events. These are pathogens that come out of the environment and interface with human beings. And if you're not used to these pathogens, then they're called novel pathogens. So a virus or a bacteria comes out of the environment and interfaces with the human population. So COVID came out of Southeast Asia, but we have our own COVIDs here, Lassa fever, Ebola, monkeypox, flu, cholera, drug-resistant enteropathogens. So there are a number of COVID-like events happening all the time. And these are just symptoms of a deeper problem. And what is that deeper problem? So I think we need to focus for us here. Otherwise, we're just going to be putting out fires several times a year. There are underlying issues. And we need to start to understand and investigate and research what the parameters of what we call the One Health paradigm. So the One Health paradigm stands on the health of the biosphere. So we as human beings are just part of the biosphere. The other two legs of the biosphere are the environment and the food that we eat. So the health of a community is dependent on the health of the environment and the type of food that we eat or the things we consume.